Hello dear students. In the previous video, we saw about the gastric secretions. So this is a continuation of the same. Here we will be discussing about some of the key important disorders, I would say, that is relevant to the gastric secretion. First is the peptic ulcer disease. Second is Zollinger-Ellison syndrome. And the third one is gastroesophageal reflex diseases. We are going to discuss them very briefly. So let's get into the topic. So first is peptic ulcer disease. So previously also I told you there is a fine balance between the HCl secretion and the mucosal protectors. When the acid secretion increases or there is a mucosal protector decreases, what will happen is it will lead on to the ulcer disease. So first the causes are there is an increase in harm which could be leading on due to the increase in HCl secretion, which might be caused many a times by non-steroidal anti-inflammatory drugs. Drugs like ibuprofen, diclofenac, all those things, they can cause severe gastritis. That's why usually they are given along with the combination of some of the proton pump inhibitors or the H2 blockers. So what they do is they are blocking the prostaglandins and decreasing the bicarbonate and decreasing the mucosa. So the NSAID mechanism of action is they are going to block the cyclooxygenase enzyme, because of which the prostaglandin levels and the bicarbonate level comes down, which is leading on to the ulcer. Second is alcohol intake. Obviously, it is going to erode the mucosa, that is going to be causing the peptic ulcer disease. Next is some of the bacterial infection like Helicobacter pylori. This Helicobacter, what it does is it will invade the membrane of the GAT and they will release the urease. So what is urease? It is going to be decreasing the levels of H+, because of which there is an increase in pH. So the area is becoming more and more alkaline, which in turn will stimulate the increase in H+ secretion. So it is just producing a lot of urease, because of which the acid is being constantly secreted to increase the HCl secretion. And it directly injures the mucous membrane also. So it can directly invade and injure the mucous membrane. Second thing is it can increase the production of urease, thereby increasing the HCl secretion. And a lot of cytokine increase or inflammatory mediators also can erode the mucosal membrane. Other than this, whenever there is a decrease in the mucosal barrier or an alkalinity decrease will cause the increase in HCl. So then how will the patient of peptic ulcer disease present to us? Many a times they will have a severe gastric pain. The abdominal pain is one of the most common symptoms of ulcer. Then they can also have heartburns around the precordial region, which will sometimes mimic like as if the patient is having myocardial infarction. So the heartburns or sometimes severe vomiting also can happen, and these will be the presentation of the peptic ulcer disease. And why we are so much concerned about this peptic ulcer disease is, suppose this is the intestinal mucosa and there is an ulcer sitting here. What it will do, it will slowly erode the mucosa and whatever blood vessels are around that region, so it will start to rupture and it can cause a GI bleed. First is gastrointestinal bleed. And if the ulcer is very severe, what is going to happen? It is going to perforate it. It is going to perforate. And just in case if the HCl, which is inside the stomach, it leaks into the peritoneum, it is going to cause a severe inflammation, and that is going to be an emergency condition. Peritonitis can happen. Before the era of invent of proton pump inhibitors and the H2 blockers, they used to do surgery for a peptic ulcer disease, because if they don't do a surgery, what will happen is they will perforate, erode, and they will cause severe bleeding and death of the patient. And this proton pump inhibitors and H2 blockers, they are one of the beautiful inventions which has saved a lot of patients from going into a surgery. So what is the treatment? No acid, there is no ulcer. So if the acid already secreted, then you can give antacids. We can give them antacids or the proton pump inhibitors and the H2 antagonist. And if the pylori bacteria is suspected, then to kill the bacteria, we have to prescribe it for the antibiotics also. So it will be a course of 14 days or 28 days, so that the bacterial levels also comes down and the mucosal regeneration also happens. So this is the treatment option. Next, coming to the next syndrome, that is Zollinger-Ellison syndrome. So this is ZES. What does this Zollinger-Ellison syndrome is? It is actually a cancer condition wherein there is a tumor in the G cells. What is the function of G cell? The G cell is going to produce a lot of gastrin, and gastrin is going to secrete the acid. In a normal person, what happens is, whenever there is a gastrin and acid production is there, this acid will go and inhibit the gastrin. So the gastrin levels will fall down, further acid secretion will decrease. This happens in a normal person. But here what is happening is there is tumor in the G cells which is producing the gastrin, and there is an increase in acid secretion. Can this acid go and tell the tumor cell to reduce the gastrin secretion? The answer is no. It is a carcinomatous cells. It is not going to listen to any kind of feedback. So it is going to constantly produce acid. So in this patient, there will be an increase in acid and there will also be an increase in gastrin. Generally, when the acid level increases, it will inhibit the gastrin levels, but here both of them are going to be increased to tremendously high levels. And this disease is also known as gastrinoma. So to suppress the acid secretion, somatostatins can be tried, but later on the patient might have to be taken in for surgery. So that is the option for Zollinger-Ellison syndrome. Next, coming to gastroesophageal reflex disease. Here what happens is the lower esophageal sphincter, when the food is delivered into the stomach, it has to close back again. But what happens here is it is lax. Lax means it is loose, we can say. There is laxity or looseness of the lower esophageal sphincter. Because of this, what happens is when the acid is being secreted, this acid can reflexly enter into the esophageal area. So what they will do? They will start eroding the esophagus. So generally the tone of the LES is around 30 mm of Hg. Whenever there is a decrease in tone, there is a reflex which is going to cause the heartburn. But if it is happening for a very long time, what is going to happen? The esophageal will go for ulcer and it can cause severe bleeding. It can go for perforation, just like the peptic ulcer disease. And sometimes it can turn into some kind of cancerous conditions also. Because of the constant erosion, it will lead on to one condition called as Barrett's esophagus. What is this Barrett's esophagus is? The esophageal epithelium is generally squamous in nature, but slowly because of this acid, it is getting mutated and they will turn into a columnar epithelium, which is the Barrett's esophagus. And this Barrett's esophagus, in a long-standing for a very long time, it can get converted into a cancer esophagus also. So that level of severity can go, but again, we are gifted to have the proton pump inhibitors and the H2 blockers. So these are some of the applied aspects of gastric acid secretion. So in the next video, we'll be discussing about the pancreatic secretion, biliary secretion and the intestinal secretion. So thank you for watching the video. If you have any further doubts, kindly drop it in the comment section. I'll be happy to make a video or clear your doubts. Thank you so much.